Okay, so health visiting, I was in this placement for about 4 weeks, and they shared me between the school nurses as well, but that's kind of a separate video. So this video I'm totally focusing on health visiting and what I did with the health visitors. Okay, so health visitors look after children from when they're newborn to when they're school age, so about 4, and they see these children throughout different kind of stages of their life. They have newborn visits. Every new parent gets a visit from a health visitor, and they just do the checks on the baby, make sure the baby's okay, make sure the mum's okay, and particularly looking at the mum and making sure that she's educated about things like feeding and cot death and depression and safeguarding against all these things. So they're really there for the parents, which I really liked, because it was a kind of different perspective. And again, one of the things I love about community that I've said in previous videos is that you do have that one-to-one relationship and that time to build up relationships with the people that you work with, because you're in their own home, they're comfortable, you're coming into their place, and I really like that aspect, rather than kind of them coming into a really scary place where they're really anxious, such as like a hospital or a health centre. And then they see the children again around 6 to 9 months, when they do teaching on again the development that they should be having at that age, and weaning and safety, and they kind of have a PowerPoint and they do a talk, answer any questions, and in that session they weigh the babies and they do their length as well and record that in their red books. And they also get seen then at 2 years old, again for height and weight checks, and to make sure that kind of lots of behavioural things at that age, kind of terrible twos, how they're managing behaviour, how they're managing their food times. Lots and lots of parents have real issues with getting their children to eat certain foods and things, so there's lots of advice around that as well. But that mainly happens in health centres and in children's centres, whereas the newborn visits happen in their home. So that's kind of the basic thing that health visitors do, and they have lots of other roles as well as that, so a lot of safeguarding. So as parents or children on child protection plans or child in need plans, so they have a parent that's not well, has a physical illness, a mental illness, some kind of disability, or they might have a parent that is at risk by a partner, or they might have issues with drug abuse or alcohol abuse or something similar to that. And they just go in and kind of see how they can help with that situation and assess that situation. So any parent that has a child that is, if the police go to a situation where there's a child involved, that gets, it's called a Merlin report, gets sent to the health visitors, and the health visitors have to go and assess that situation and go and visit that family and just check what happens and then document that. A lot of this job is documenting, lots of online documentations kind of in regards to that. I worked in this placement in a very deprived area, and that was great health visiting experience. Lots of kind of people that were training to be health visitors wanted to come into that area because it's a great area for health visiting, and it was really insightful, really good learning opportunity. It was very different to ordinary health visiting because you had all the social issues and all the depravity and things in that area. But it was a really good experience, and that's just a super quick overview of the kind of things that I did and saw there. If you have any questions, just comment below or get back to me, and if there's anything I've forgotten, I'm sure I'll be able to answer your questions. Right, see you soon.